let's go. This time, let's talk about prioritizing clients who are at risk for lung cancer. Okay, let's move on. Yes, Annelyn, I agree with you. You believe you can. Push it. Okay, let's move on. Okay, now, if you talk about lung cancer, there are three classifications of risk factors. You have modifiable, which means factors that you can change either by removing it in your environment, or if you can't remove it, you have to move away from it. Okay, non-modifiable risk factors, meaning things you cannot change, like heredity. You can't change your genetic makeup. And third would be uncertain. Uncertain are those things which research have yet to confirm as, okay, risk factors to lung cancer. Okay, let's move on. Let's begin with the modifiable risk factors. The leading risk factors, okay, to cancer would be definitely tobacco smoking. That's the leading risk factor. Now, here's an NCLEX issue I'd like to clarify with you guys. What about if the patient already has quit smoking? Is the patient still at risk? Everybody say yes or no. My question is, what about if the patient has already stopped smoking? Is he still at risk? Yes or no? Okay, 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 okay. Excellent.
Yes.
Yes. Now, the question is, what do you need to look for when you're prioritizing who is most at risk? You have to look for how long has the patient stopped smoking. Okay? So how long has it been? Because if the patient has just stopped smoking 2 years ago, they are still 100% at risk. So when will their risk factor related to smoking decrease? Remember this class, this is an NCLEX issue. According to research done by the Vanderbilt University Medical Center, they found out that 5 years after you quit smoking, you decrease your risk by 39%. And 10 years after you quit smoking, you decrease your risk by 50%, but you are still at risk. Okay? And 15 years after you quit smoking, your risk in terms of developing stroke could be equal to a non-smoker. So in other words, there has to be a cleansing period. It's not as if you just quit smoking and you would claim that you're no longer at risk. It would depend on how long ago did you quit smoking. Okay? That's true, Giancarlo. It depends on how long ago the patient stopped smoking. Okay? The longer period you quit, the better. Okay? So remember, quit it 2 years ago, you're still at risk, 100%. Okay? Quit it 5 years ago, you decrease the risk by 39%. Quit 10 years ago, you decrease the risk by 50%. But you are still at risk. Okay? So if this will be turned into an NCLEX issue, how would it look like? So what if you have several options that a patient who is smoking who quit 3 years ago, a patient who is smoking who quit 2 years ago, a patient who is smoking who quit 10 years ago, a patient who is smoking in his teenage years and is now 60. See? Okay? So the patient who is now 60 and has quit after his teenage years has very well quit smoking for the longest possible time, and therefore the patient could be least at risk. And he is most at risk then. The client who just quit smoking less than 5 years back. Okay? Excellent. You are learning fast. You are reflecting with me. I love it, guys, when you share your thoughts. Okay? Very true. Very least at risk for those who have quit smoking more than 15 years ago. Okay. Now, it's not just about tobacco smoking. Secondhand smoke could also occur. Remember, I know a family friend, okay, who is not a smoker. The irony is she's a nurse. And you know what she did when she was retiring? She was like gathering all the leaves underneath the tree every afternoon and burning them. Then eventually when she had her executive checkup and MRI, she had tumors all over her lungs. That came from burning the leaves every day. So that is a secondary, okay, Okay, now I remember my patient last night. He claimed he quit smoking 30 years ago and he's 66. Okay, the risk is now equal to the non-smoker. Okay, thank you, Jane, for your thoughts. Okay, next, exposure to asbestos. Now, asbestos could be found in movie houses. Asbestos could be found in basements. Now, the key thing that you have to remember is the dangers of your exposure to asbestos, uranium, arsenic, deuterium, cadmium, silica, vinyl chloride, nickel, chromium, coal products, mustard, chloromethyl, ethers, diesel, exhaust. The danger is when you are in a closed environment, because, okay, there is no way that these things would go outside, and there's a greater risk that the patient would be inhaling these things when they are in a closed environment. Okay, now remember, okay, elements found in the environment, okay, like your radon, is the leading risk factor for non-smoker. Where do we find radon? Well, it's found in the soil, it's found in the rocks. So those who are actually living in houses with basements, okay, and the basements are walled with rocks, and you don't have windows in the basement, then there's no way for the radon to be to actually get out of the place. So chances are you are inhaling radon, and that is a risk factor. So it's a different story when you go mountain climbing and you get exposed to rocks and soils with radon, but that's an outdoor environment in which radon could actually be dispersed, and it does not necessarily go into your lungs. Okay, so if you are in an external environment, that's perfectly fine, lesser risk. But if you have a basement that's walled with rocks and soil, then that's an increased risk for lung cancer among non-smokers. Okay, beta-carotene supplements, yes, you're right. Okay, there are studies now that claim that some cancer patients develop this after being exposed to beta-carotene supplements for the longest time. And of course, presence of arsenic in drinking water. Okay, now what about the non-modifiable risk factors? Previous radiation therapy, if you've been exposed, okay, to radiation therapy, air pollution, okay, slightly increase the risk. However, once again, if you did something about this, you move out, and that's the reason why I'm having asthma. Here's a funny thing that I did. Okay, so I had asthma, and we used to live in Makati, and so I said, okay, if ever I would be blessed to be able to get a house, I'd be happy to have one in Baguio, the summer capital in the Philippines. So I was hoping, okay, since Manila is the most polluted area in the Philippines, I was hoping I'll get a respite from the pollution. So I moved to Baguio. What happened? Baguio is the second most polluted place in the country. So I move out from the most polluted to the second most polluted. Okay, so if you move out, make sure that you would be able to go into an area, rural area, that's not as polluted as the urban areas you're from. Okay, how about sprays now? If the sprays contain any of these compounds, okay, like chloromethyl or ethers, okay, then that could also be a risk. Okay, now personal or family history. Now, let me tell you about this class. If the question, here's an NCLEX issue, is asking you who is most at risk, okay? And if you have two smokers in the options, but one smoker have an added risk factor of having a family member with lung cancer, choose that. Because only genetic predisposition, okay, increases your risk, okay, the highest possible way. So if the question is who is most at risk, pay particular attention to the smoker who has a family member who had lung cancer. Okay? Okay, family history. So let's move on. Now, what about those factors that are considered uncertain or needs validation? Well, research has yet to validate whether smoking marijuana could be a risk factors, or the use of e-cigarettes, okay, or talc and talcum powder exposure. Okay, so pay particular attention. This would still need, okay, validation. So if you'll be asked a select all that apply type of question, which patient, okay, which factors found in a patient would increase the risk for lung cancer? Smoking, yes. Exposure to radon, yes. Personal family history, yes. Air pollution, yes. Previous radiation therapy, yes. Okay. E-cigarettes, no. You don't check it. Still uncertain. Smoking of marijuana, no. Still uncertain. Okay? So you have to remember your concepts and you have to reflect on this. Are you learning, class? How do you like what we're doing at the moment? I'm sure you are able to at least clarify your thoughts. Okay, so let's move forward. Thank you very much for the affirmation, Cheryl, Mary Jean, Glenda, Ninita. You are learning. Thank you so much. 100%, says Daryl. Thank you, Daryl. Okay, so let's move on. Very helpful. Thank you, Rhoda. Okay. Let's try now to use what we learned, okay, to answer a question. Now, what I would like to do is that I'd like to open the chat box again and see if you are actually, okay, thank you. Indeed, very informative from Giancarlo, thank you. From Precious, okay, thank you. You're learning, thank you, Noemi. Okay, so let's try answering a sample question. Okay, here is the sample question. The nurse, okay. The nurse is interviewing the following clients after obtaining personal and health history of the clients. The nurse identified factors in the client's history that could be associated with some forms of cancer. Who among the following clients is most at risk to lung cancer? So we're talking about specifically risk factor to lung cancer. 35-year-old, option 1, who moved to a smaller rural village from an urban area with air pollution 5 years ago. 40-year-old who got exposed to radon in an outdoor environment. 57-year-old who quit smoking 2 years ago. 19-year-old with bronchial asthma. Everybody saying excellent. You got it right, Hazel, Madeline, Shidel, Ivy, Regina, okay, Giancarlo, Jean, Desiree, Noemi, Nailani, Lizelle, Jade. You all are right. Okay, the answer is actually number 3. A 57-year-old who quit smoking 2 years ago. What did we say? You decrease your risk if you have quit 5 years ago by 39%. If you quit 10 years ago by 50%. Wow, they're learning. Excellent. Okay, now, tell me, if you don't have functional concepts with you, come on, let's be honest, okay? If we don't use functional concepts this way, is this easy to understand and analyze? Tell me. Yes, John. No. That's what I'm trying to say. Functional concepts help you. sabi ni Chan, nga daw. I love the term. nga. Carolyn says difficult. Okay. Okay. But this is the reason why I created this program. Because let this be my legacy, okay? When you pass the NCLEX, sir, I want to be trained how you do that. I want to teach. Come on, I will teach you how to do this so that you can help people in your environment, in your place. If you want to put on your own training center, do something like this, you need technology assistance from me, please feel free to do so. I'm on that stage where I'm trying to mentor the next young generation. Okay? Jane says, no functional concept, no answer. I'm trying to mentor the next generation so that you will be empowered. I will not be here for the longest time, you know. I could also grow old, okay, even with the help of friend Vicky Bello. But definitely, okay, we will all die anyway. So I would want to be best remembered by the thought that I was able to come up with a system that helps my colleagues in the nursing profession pass their test. Pa-retire ka na ba, sir? Kung hindi nyo na ako kailangan, I'll retire. Okay? But if you still need me, I'm still here. Thank you so much, Justin. Okay. Amen to your advocacy. Yes, Cheryl. Join us once you pass your test, and I'm going to share with you guys what I have. As I've been saying, this industry has been so good to me, okay? From the poor guy in the northern part of the country in Rosario, La Union, to somebody who authored for great publications like Mosby, Elsevier, Johnson, Bartlett, you say, I have no more to ask for. I'm so just happy that I'm able to share what I'm trying to share. Actually, that's the reason I love you most, sir. I am learning quickly, Sayo. Thank you. Now, the richest, no, I'm rich in terms of Mentored nurses. I'm rich in terms of friends. Don't retire yet, sir. We need you. Okay. Self-actualization level. So inspiring. Ang exemplary. You're a gift to us, RNCS. Okay. Hi, sir from Rosario. Hi, Sapphire. You're from Rosario. I salute you. Thanks for being an inspiration. Thank you, Janice. Okay, let's move on.